Good morning, students. In this video, we discuss the common respiratory diseases. In this, we discuss about the asthma, bronchitis, pneumonia, and tuberculosis. So first, we started with the asthma. Asthma is a lung disease in which airway get inflamed and produce extra mucus. Okay, and due to the inflammation means swelling, okay, which makes the airway swollen and narrow, okay, and this lead to difficulty in the breathing, and it is basically caused by cold airs, air pollutant, pollen, dust, mold spores, and pet hairs. So I'm adding small clips of the video for your better understanding. So let's see.
Today's topic is asthma. Asthma is a chronic disease involving the airways in the lungs. These airways, or bronchial tubes, allow air to come in and out of the lungs. If you have asthma, your airways are always inflamed. They become even more swollen, and the muscles around the airways can tighten when something triggers your symptoms. This makes it difficult for air to move in and out of the lungs. Causes: asthma is a chronic condition in which the airways that carry air to the lungs are inflamed and narrowed. Inflamed airways are very sensitive, and they tend to react to things in the environment called triggers, such as substances that are inhaled. When the airways react, they swell and narrow even more, and also produce extra mucus, all of which make it harder for air to flow to the lungs. The muscles around the airways also tighten, which further restricts airflow. Asthma triggers are different from person to person and can include airborne substances such as pollen, dust mites, mold spores, pet dander, or particles of cockroach waste. Respiratory infections such as the common cold, physical activity, as in exercise-induced asthma, cold air pollutants and irritants such as smoke.
So next is bronchitis. Bronchitis is basically swelling of bronchial tubes that carry air in and out from the lungs. So let's understand.
Today's topic is bronchitis. Bronchitis is an inflammation of the air passages between the nose and the lungs, including the windpipe or trachea and the larger air tubes of the lung that bring air in from the trachea or bronchi. Bronchitis can either be of brief duration, acute, or have a long course, chronic. Acute bronchitis is usually caused by a viral infection, but can also be caused by a bacterial infection and can heal without complications. Chronic bronchitis is a sign of serious lung disease that may be slowed but cannot be cured. Causes of acute bronchitis include viral and bacterial infections, environmental factors, and other lung conditions.
So next is pneumonia. Pneumonia is a bacterial disease which caused by inflammation in lungs, basically in alveoli region. And it is diagnosed through blood tests, chest X-rays that help in diagnosis. So let's understand pneumonia.
Pneumonia is a common infection of the lungs affecting mostly the microscopic air sacs, the alveoli. The function of the respiratory system is to exchange oxygen and carbon dioxide between the body and the environment. This process takes place in the alveoli of the lungs. Inhaled oxygen moves from the alveoli into the blood in the capillaries, while carbon dioxide relocates from the blood to the alveoli to be exhaled out of the body. In people with pneumonia, these air sacs are filled with fluid or pus, hindering the gas exchange process, resulting in difficulty breathing and a cough reflex. Other symptoms may include chest pain, fever, chills, and confusion. Pneumonia is not a single disease. A large number of various organisms can cause pneumonia. Bacterial pneumonia is the most common, with Streptococcus pneumoniae being the main culprit. Viral pneumonia.
Next is tuberculosis, and it is caused by Mycobacterium.
Tuberculosis, or TB, is one of the oldest and most common infectious diseases. About 1/3 of the world population is believed to be infected with TB. Fortunately, only about 5% of these infections progress to active disease. The other 95% of infected people are said to have a dormant or latent infection They do not develop any symptoms and do not transmit the disease. Tuberculosis is caused by a rod-shaped bacterium, or a bacillus, called Mycobacterium tuberculosis. An infection is initiated following inhalation of mycobacteria present in aerosol droplets, discharged into the atmosphere by a person with an active infection. The transmission process is very efficient, as these droplets can persist in the atmosphere for several hours and the infectious dose is very low. Less than 10 bacilli are needed to start the infection. Once in the lung,